Thank you for joining us today as we walk through how we are using lab data to lead the way to value-based care. I'm Zach, Partner Engagement Director at hc1, based out of Indianapolis, and I'm here with Aaron.
Hi, I'm Erin Monteverdi, and I'm the Executive Director for Information Ventures at Quest.
Thank you, Aaron. To start this off, we just want to put into perspective the impact of low-value care, something we're helping to address. It is estimated that $765 billion is spent on low-value care. Unnecessary services, inefficient delivery, missed prevention, therapy failure, those items account for 30% of the healthcare spend. At hc1, we made it our mission to build solutions that deliver on the promise of high-value care. Now, I'll hand it over to Aaron to talk about how low-value testing is contributing to this wasteful healthcare spend.
Thank you, Zach. So on the flip side of low-value care, we're terming this low-value testing. And there's two areas of contributions that we've categorized, that is overutilization and underutilization. And with regard to overutilization, it's around the tests that are actually ordered but not indicated. It also could provide insights to test panels that are delivered testing and patient pressure. These categories of overutilization are usually the low-hanging fruit when it comes to hospitals and health systems of areas to address immediately. The flip side of that with regard to low-value testing is underutilization. Underutilization can be defined as tests that are actually indicated but not ordered, or delay in diagnosis or a misdiagnosis. And these are two really important categories. If we look at a low-value testing contribution as well, there were a lot of studies that had been done. In fact, we sourced a study that was done with some Harvard Medical research firms. And what happened was they looked at both overutilization and underutilization. Overutilization contributing actually to 20%, underutilization contributing to twice that, which is 44%. And lab stewardship, absolutely, from the data that we've seen, in an example of overutilization, a lab test would be continuing to draw daily for, say, CBCs or CMPs. And then again, another example of underutilization of a lab test would include failing to provide HbA1cs every 6 months to a patient at high risk for diabetes. We really feel, given the scope of this study, we absolutely feel it's reasonable to think that this estimate applies to most clinical testing environments, and why lab stewardship is the right tool to address both over and underutilization. When we think about introducing our Quest Lab Stewardship program that is actually powered by hc1, Quest as a national leader in providing lab testing services, we have the data and the medical expertise necessary to help hospitals and health systems optimize their health care. Partnering with hc1 as a proven cloud-based technology in partnership with AWS is able to bring our large repository of data into the hands of hospitals leadership in order to provide dashboards and visualizations in real time. Together, this partnership with Quest and hc1 provide a new way for hospitals to achieve their lab stewardship goals. As Quest looks at lab stewardship powered by hc1, we actually try to push the envelope when it comes to being more than a lab. We actually have consented direct-to-patient and provider relationships. We have a very broad geographic reach via our network of over 2,000 patient service centers. We have over 20,000 mobile care professionals. We have an unrivaled patient data repository with over 48 billion lab events. The broadest advanced diagnostics test portfolio in existence, with ongoing R&D and companion diagnostics, as well as in-home testing. We have very deep clinical expertise, and we leverage our over 650 employed MDs and PhDs. We also, with our Powered by hc1 partnership, we have other unique sets of partnerships in both data and analytics areas. With our extensive coverage and medical expertise, Quest also has one of the largest lab data sets in the world, which introduces the question of what technologies help efficiently process and manage all of that data.
Thank you, Aaron. When you think about how large that Quest data set is, think about the reality that 1 in 3 Americans have had a test performed by Quest. And every test can produce around 10 to 20 different result transactions. So we're talking billions of test results. So we're using AWS to power some of that underlying technology to store and process this data to deliver the Quest Lab Stewardship solution. hc1 is proud to have been partnering with AWS for almost a decade now, and we've achieved the status of a certified healthcare competency partner. AWS has been wonderful in supporting our growth, our needs, in particular when bringing on a large reference lab like Quest Diagnostics. There are a number of HIPAA-compliant AWS services we utilize. At the forefront are Aurora, EMR, and ECS. In this diagram, you can see we're ingesting billions of transactions from Quest directly, as well as from other health system data sources. Processing this amount of data continuously creates some challenges. To address the challenge of quickly ingesting billions of records from Quest, hc1 leverages AWS EMR to streamline the data pipeline before loading the data into AWS Aurora. And to address the challenge of applying these medical lab guidelines or rules to identify low-value testing on every single transaction, we use AWS ECS to scale capacity, which allows for the efficient transactional evaluation as the test volume fluctuates. And that is what enables us to transform at scale all of this lab data into personalized healthcare insights. We organize and enrich data sets to create relationships, such as relationships between ordering locations and their providers and patients. All of this ultimately provides the actionable insights that enables medical and lab leadership to drive real targeted interventions and improve upon their delivery of high-value care. So let's take a quick walkthrough of some of the insights we're able to generate through lab stewardship. Here you're looking at the tests that were ordered outside of the medical lab guidelines. We call these exceptions. So if a test was ordered and flagged as an exception, it shows up on this dashboard. Let's take a quick look through some of the insights we were able to generate through the lab. Let's take a quick walkthrough of some of the insights we were able to generate through the Quest Lab Stewardship solution. Here you're looking at the tests that were ordered outside of the guidelines. We call them exceptions. If a test was ordered and flagged as an exception, it shows up in this dashboard. This is the view that informs lab stewardship committees and medical leadership of where to focus their improvement strategies. We can see in the left bar the graph that our exceptions are increasing over time. And in the bottom right, you can see that CBCs are on the top of the list for exceptions that require interventions. Whether it's a lab, a hospital, a health system, or a health plan, or even looking at this nationally, we have the capability to organize and normalize billions of lab results to identify where low-value testing is occurring. Here is a picture of our live filtering capabilities built into the platform. As part of the refinement and enrichment process, we organize lab utilization data into meaningful groupings or categories. For example, location type, as you see here, the emergency room, outpatient, inpatient. We even organize it down to the individual ordering locations or individual providers. This makes filtering by a particular group of orders incredibly simple and intuitive for lab leadership, medical leadership, any of those users that would be looking at this type of information to implement some type of intervention programs. Then we group the medical lab guidelines into categories or types, but we also make the individual rules selectable, as you see here. This allows a leadership to monitor any of the low-value testing that's occurring and study it at a micro level as well as that higher macro level. Here in this visual, you can see every guideline that's been applied. There's quite a few in the bottom right, and this is a way to visualize the most common exceptions and to see whether or not those interventions that are in place are actually driving real change, as you would anticipate to see a decrease in the number of exceptions over time if those efforts are actually working. Now, there are hundreds of publicly available guidelines, and medical leadership is trying to determine when, where, how much do we need to intervene. And since you can't realistically prompt a provider for every single order, which would cause prompt fatigue, leadership needs to learn about the exceptions that would provide the greatest value without unnecessarily disrupting the provider workflow. So we need to explore a little more to better understand where interventions would be best served. With the data organized as seen here, leaders can gain a better understanding of unnecessary testing, such as by exception type and test name as you see here. For obsolete tests, under the test name SED rate being at the top of the list for the number of exceptions. Or leaders could look at individual providers with the most exceptions, as you see here on the right, and even drill down into a breakdown of which exceptions are most common for that one physician. This is how we can drive a more personalized, targeted approach to reducing low-value care, rather than making blanket statements that would impact every single provider potentially unnecessarily. And finally, Quest Lab Stewardship takes you all the way down to that micro level, to the individual order detail level, providing order listings to share with medical directors or care teams that would review individual patient cases. Now, to summarize some of the numbers that we processed to date, so we are over 10 billion results that have been processed to date. That includes 290 million lab orders that have been organized and associated with 150 million unique patient profiles. This is an enormous data set to organize, but once it's organized, we can do a lot of analysis that identifies where and when the most appropriate intervention should be placed to reduce low-value care or low-value testing. Looking at the set of medical lab guidelines that we've applied to date, we've seen some testing get flagged upwards of 30% of the time. And considering the volume of this data and the reality that nearly 70% of all treatment decisions are based on lab testing, Quest and hc1 have an enormous opportunity to identify low-value care. Now, that's current state, phase one. In the near future, we're looking to identify underutilization, as Aaron had mentioned earlier, the scenarios where testing should have been performed to prevent an undesired outcome, such as a disease progression or even worse. So our future AWS strategies include the increased use of AI and machine learning capabilities included in SageMaker to identify those patients in need of appropriate testing based on specific criteria like disease states and prior test results, as well as the use of AWS's Comprehend Medical to normalize data that's stored in notes and observations made by clinical staff. So Aaron, I'm going to hand this over to you to close this out and talk about some of those future stages that we're looking for.
Thank you, Zach. We're actually very excited about helping labs bring greater value to healthcare by extending these technologies to better manage some of the most critical and costly diseases. Some of these being considered include what Zach covered, which is diabetes, kidney disease, as well as helping to identify population where there's an actual opportunity to eliminate diseases like hepatitis. There's so much we can do with the vast amount of insights hidden within lab data. With the right partners like hc1, the right technologies, AWS Web Services, we continue to help health systems and health plans better manage their patient populations through the delivery of improved care.
So that is the conclusion of this presentation. We thank you all for joining and listening in and wish you have a wonderful day.